Okay, welcome back. Good morning, all of my dear viewers. So, today's session we are going to discuss a very important topic of community medicine, that is incidence rate. So, first we try to understand what is this incidence rate. So, according to the definition of incidence rate, it is a total number of new cases in a specified population during a specific duration of time. So, in a specific duration of time, the total number of new cases that comes out, it is called a incidence rate. So, what is the meaning of this? A specific duration. A specific duration means we can calculate the incidence rate for a week, per month, or commonly we calculate the incidence rate for year. So we understand this incidence rate with the help of examples. First we going to read what is the definition of incidence rate. So incidence rate, it is number of total number of new cases in a defined population during a specified period of time or a specific period of times. What is its formula? The total number of new cases at the end of the period. We basically calculate the total number of cases at the end of the study. For example, we are going for the study of 1 year. Then we calculate how many total number of new cases that comes at the end of a study, I mean a 1 year. So total number of new cases at the end of the period upon population at risk. So here we are going to discuss what is the meaning of this population at risk. Let's suppose in a village having a 1000 population. So in among 1000 population, 100 people are the immunized. So they having almost no any chance for developments of disease in them, and 100 people are already having a disease. So this 100 and 100 200. So these 200 people are excluded from the whole population. The whole population is 1000. We excluded 200 people. So total remaining population is 800. So this total remaining population after excluding the disease peoples and the immunized peoples, these 800 people is considered as the population at risk. So this is the meaning of population at risk. So we put the data in the formula. Okay, now during the study it is found that 100 cases will come. I mean 100 people is affected by any disease. So in the numerator we put the formula, that is the total number of cases that present or comes at the end of the study, which is 100, and this 800 is the population at risk multiplied by 1000. So overall value is come as 125 per 1000 population per year. So this 125 per 1000 population per year is the incidence rate. Another thing is, what is the specific incidence rate? A specific incidence rate means when we calculate the incidence rate for any specific disease. Let's suppose we are calculating the incidence rate for a tuberculosis. So whenever we calculating the incidence rate for any specific disease, it is called a specific incidence rate. So in a specific incidence rate, let's suppose we calculating the specific incidence rate for the tuberculosis. So total number of tuberculosis cases in a specified duration, I mean 1 year, population at risk, and multiplied by 100. So this value will come in percentage. No, whenever we multiply by 100, the value come in percentage. Whenever we multiply by 1000, the value comes in number of disease person per 1000 per year. So this is the difference between 100 and multiply by the 1000. Now what are the uses of incidence? The first use is for monitoring the health status of the community. So with the help of this incidence rate data, we can monitor the health status of the community. I mean, which diseases are more common in our community, which any disease is decreasing or increasing. So these all things we can monitor with the help of this incidence rate data. Another thing is monitoring the effectiveness of the program. Okay, we also monitor the effectiveness of program, that is we any program we launch in a community, is it effective or not. If the incidence rate is high, that means the program is not effective. But if the incidence rate is low, it concludes that the program is effective. Other things is for the distribution of disease. Okay, with the help of incidence rate, we also calculate the distribution. Also find out the distribution of disease. That is, which area having a more which having a more incidence rate. That means this area having a more distribution of disease. Okay, one important point is the incidence rate not depend on the duration of the disease. Incidence rate is not depend upon the duration of disease. It it will not matter that a person is affected for disease for how many years. Let's suppose if any person is affected for any disease of 10 years, then there is no any role of this duration of disease for the calculation of incidence rate. Okay, so this is all about the incidence rate. Next video we discuss the prevalence.